High blood viscosity or polycythemia is a medical condition characterized by an abnormal number of red blood cells in the blood. An excessive accumulation of red blood cells is usually caused by underlying health complications such as liver diseases, disorders in the cardiovascular system, or the blockage of blood vessels. High blood viscosity has various symptoms, but in this video I want to thoroughly discuss and explain the 10 most frequently observed clinical signs of high blood viscosity to you. These symptoms may appear continuously or at specific times, such as during physical activity or periods of intense stress. After watching this video, you'll become familiar with the symptoms of high blood viscosity and be able to take timely action to prevent dangerous complications. Hello and welcome to the Dr. Koob YouTube channel. I'm Mohammed Zari, an instructor in internal medicine and surgery at Shahid Beheshti University of Medical Sciences in Tehran. Let's get started and learn about the symptoms of high blood viscosity. The first symptom is chest pain. With increased blood viscosity, due to the pressure on the heart and chest tissues, chest pain can occur. So one of the symptoms people may experience if they have high blood viscosity is chest pain. The underlying reason for experiencing this kind of physical pain is that blood circulation has significant difficulty passing through the narrow vessels. When blood viscosity is high, not enough oxygenated blood reaches the vital heart tissues and chest muscles, and this chronic problem puts pressure on the heart and surrounding chest tissues. If these persistent pains continue to occur, you should immediately see a qualified specialist doctor. If the pain becomes severe, the doctor may recommend that you take specific heart medications. The doctor will assess your condition to determine the exact cause of the pain and the best course of treatment. The second most common symptom of high blood viscosity is shortness of breath. Shortness of breath can have various causes such as lung problems, heart issues, muscular disorders, or even anxiety. Having high blood viscosity is also one of the reasons that can lead to shortness of breath. As blood viscosity increases and the speed and volume of blood flow in the vessels decrease, the supply of oxygen to the body's tissues also drops, which can lead to shortness of breath. People who have high blood lipids usually experience shortness of breath more often. In this situation, you should see a qualified medical specialist to resolve the problem. If someone experiencing shortness of breath is also suffering from high blood lipids, the doctor will prescribe lipid-lowering medications such as gemfibrozil to address the issue. These medications should not be taken without a prescription and must be used strictly under the direct supervision of a healthcare professional. The third symptom is sweating. Sweating is a natural response of the body to heat, stress, and exercise, and its purpose is to cool the body and keep its temperature within a suitable range. If blood viscosity increases, the body uses various complex biological mechanisms to cool itself down in order to maintain physiological balance and reduce potential damage. One of the primary ways the body reduces its temperature is by significantly increasing the production of sweat. If your body sweats more than usual, you should consult a medical specialist to determine the exact underlying cause. Medical professionals may suggest taking certain supplements for individuals who have high cholesterol and high blood pressure to help maintain overall health and keep the body in an optimal, healthy state. The fourth symptom is headache. Having high blood viscosity can frequently lead to persistent headaches and dizziness. The reason for this disorder is that blood does not flow smoothly through the vessels, resulting in the brain receiving a reduced supply of oxygen, which causes the person to experience headaches. On the other hand, individuals with high blood viscosity are more likely to have high blood pressure, which can also lead to headaches. Headaches have various causes, and high blood viscosity is one of them. For an accurate diagnosis, you should see a doctor. Let's move on to the fifth symptom. Please hit the like and subscribe buttons before hearing about the fifth symptom. There is a direct relationship between blood pressure and blood viscosity. As a result, if blood viscosity is high, blood pressure will also increase. Because as blood viscosity increases, the viscosity of the blood, that is, the resistance of blood to flow, also increases. In this specific situation, the heart has to work much harder to pump oxygenated blood to all parts of the human body, which results in reduced blood flow within the vessels and increased blood pressure. The sixth cause is redness of the eyes. An increase in blood viscosity can cause swelling and redness of the eyes. An increase in blood viscosity may be due to various factors such as not drinking enough water, excessive focus on daily tasks, intense physical activity, diabetes, cardiovascular diseases, or high blood pressure. In people who experience high blood pressure due to increased blood viscosity, their eyes may become red, but various issues can be identified as the source of eye redness. If redness of the eyes is accompanied by other symptoms such as headache, nausea, vomiting, blurred vision, or pain and swelling of the eyes, it is best to consult a doctor. The seventh symptom is blurred vision. Blurred vision and increased scattered lights are among the symptoms experienced by those with increased blood viscosity. In this condition, visual clarity decreases in individuals. In addition to increased blood viscosity, issues such as eye diseases, nervous system disorders, and high blood pressure can also cause blurred vision. In most cases, increased blood viscosity alone cannot be the main cause of blurred vision. Therefore, to accurately determine the cause of this condition, you should consult a doctor. The doctor will perform tests to determine the exact cause of the blurred vision and will prescribe the appropriate treatment based on that. The eighth symptom is a change in skin color. People who have high blood viscosity may also experience changes in their skin color. The skin of these individuals frequently begins to turn blue, purple, or red. The main reason for this noticeable color change is the nitrogenation of hemoglobin. Hemoglobin is a type of protein that is attached to red blood cells and is responsible for transporting oxygen throughout the body to different areas. With increased blood viscosity, the amount of oxygen delivered to the body's cells decreases. In such conditions, hemoglobin binds to nitrogen-containing molecules, and this process causes a change in skin color. In some cases, skin discoloration due to high blood viscosity may also be a sign of more serious problems. Therefore, if you notice any changes in your skin color, you should consult a specialist doctor for further evaluation of the cause. The ninth cause is increased drowsiness and reduced concentration, which is a problem that almost everyone experiences to some extent. High blood viscosity can lead to an increase in drowsiness and a drop in concentration. This feeling occurs due to a lack of oxygen in the body's cells. An elevated level of blood viscosity leads to a reduction in the count of red blood cells and an increase in the concentration of hemoglobin within the bloodstream. When this hemoglobin becomes nitrogenated and the red blood cells' ability to carry oxygen decreases, people often feel drowsy and tired. As a result of these changes, their mental concentration also drops. We've reached the last cause of high blood viscosity. An increase in blood viscosity can cause general weakness, making people feel constantly tired. The significant reduction in blood oxygen levels is the most important factor that causes this sensation in people. As blood viscosity increases, the amount of nitrogen-containing hemoglobins in the blood subsequently begins to rise, and as a result, the red blood cells' ability to carry oxygen is diminished. With a reduction in oxygen delivery to the body's cells, individuals often begin to feel tired, much more rapidly than usual. In addition to oxygen deficiency, high blood viscosity can also lead to increased blood pressure and stimulation of the central nervous system. When we look at the final outcome of this process, this causes people to experience persistent sensations of fatigue and weakness. In addition, people with high blood viscosity may suffer from various chronic conditions such as diabetes, thyroid disorders, or cardiovascular diseases, and these resulting health problems can cause them to experience significant fatigue. If your blood viscosity is significantly elevated, it may lead to dangerous symptoms such as a heart attack, a stroke, chronic kidney disease, and other cardiovascular problems. Therefore, if you experience any of these symptoms, it is best to consult a medical specialist so that a check of your blood viscosity level can be performed. Thank you for staying with me until the end of the video. If you have any questions, leave a comment and I'll personally respond. Goodbye.